Hey guys, welcome back. Another episode of the Mill Spill. I'm Dr. Aaron Miller, physical therapist and fellowship trained orthopedic manual physical therapist. I'm here to tell you how therapy is like dating and when to dump your physical therapist. Make sure you listen to the whole thing through so that you get your strategies as a patient on how to recognize when it's time to call it quits and cut the cord with your therapist and move on or try a different strategy to improve and invest in yourself, like I always say, right? So you've taken the first step, you've recognized that you need help, you need therapy, you need something to improve your pain, your movements, you're just not living to your potential. So you come into therapy, and the first thing, you have an hour, 1 hour, sometimes less in some evaluations, where basically we bring you back in a room and we may introduce ourselves. We should introduce ourselves, maybe tell like a witty joke or something, cliche, therapist would say, and we bring you back into a room with myself, with a therapist, and we spend an hour with you. And the first 15 minutes or plus, it's basically get to know you. It's speed dating. It's all right. What's wrong? What's going on? Tell me your life history. A lot of the times, and which is fine because the more information we know, the better we can help you. So that subjective, that first interaction, you only make a first impression once. And I pretty much know within the first minute or two if a patient is on board and likes me, or if there's some reservation. But that doesn't mean that you can't salvage the relationship in physical therapy and in real life. So first impressions are important, but you can recover. And so we'll talk to you, get to know you, get to know about your aches and pains and things like that. And then we move into seeing how you move. We watch you walk away, we watch you walk towards, similar to dating. I may watch you walk toward me. And then if that first impression is terrible, you're walking away. So same thing, but we're looking at you. We're looking at how you move, how you squat, and how you move your arms, your neck, your head, all that stuff. We're assessing it all. So we basically get a full body scan within the first 20 minutes or so of meeting you. And that's a lot more than some can say on a first date. So then we have the audacity to then get our hands on you and feel how things are moving. Right now, if this is my daughter and some dude is touching her within the first hour, it's game over, right? The guns are coming out. But if, as far as a health professional and therapist, yes, we're getting our hands on you to see if things are even normal, just palpating to gather more information about the symptoms and scenario that you present with. So we're already, lifting shirts, moving, brushing hair aside to look at your neck, even getting in, feeling some soft tissue. So this is a very intimate interaction that you may be having with your patient within the first 30 minutes. And they have to trust you. You have to earn that, and you have to really, as a therapist, cherish it. And as a patient, understand that we're trying to help in as many ways as we can. Um, so then the question comes, you have to make that impression and you have to let them know what's going on, because you want that second date. They do too. They may not know it in the first visit that they want to come back, but if you do your job right, they'll want to come back, and they should come back because your relationship with that patient is an important and integral part of their healing and in their recovery. So you want that second date because you think you can impress upon your knowledge and skill set to them. And as a patient, you want that second date, but you have to trust that. And this is where ghosting happens, okay? In my field, and it's happened to me a bunch, you get that evaluation, you think it's good, you're like, oh, I think I got it, right? And then they don't come back. And they don't come back, and you call and they don't answer, and you get ghosted. And that tells me that something in that evaluation, that first visit, that first interaction, there wasn't a connection. And we need to be better about recognizing what that takes to keep a patient and to instill in them the the right motivation to come back. And That is where I dive into my 3 strategies as a patient to recognize if you should go back or if you should ghost, which I don't particularly like, um, even though it does happen. But then the third thing is why you don't come back, why you ghosted, and why should you dump your physical therapist, okay? And I've been dumped many times, and I guarantee you it's because of these one of these 3 reasons, okay? On that first visit, you did not get the information you needed. So the 3 things as a patient you need to look for are A, what is wrong with me? I get a lot of patients who've been told that there's a slew of things that are going on. They've had imaging, and they then think that they're a disc injury, or they're this, they're that, they're this, they're all these things, and no one can break it down to what is wrong with them. And now we don't diagnose as physical therapists, but we have PT diagnosis, and that's more important because that's based around movement, exercise, and tissue healing. So we have to describe to them what tissue we think is the problem, what's causing their pain, what movements are causing their pain, really dive in and tell them what is wrong with them so that they can fully understand and in a simple way. And that's really hard to do. And a lot of times if that's not done, patients leave confused, their questions aren't answered, they don't even know what's wrong with them, then that doesn't give them a reason to come back to therapy. That's the first thing. Second thing is that you have to communicate with them what the treatment strategies are gonna be. All right, now I've recognized this. Here is the plan. Give them the plan. People love that strategy, and you should too, because it helps you devise what way to go with them, right? So we have to develop a plan. And the third thing is you have to give them a prognosis. If we don't know tissue healing, if we don't know healing phases, if we don't know how to communicate or understand what is going wrong with you, then we can't give you proper prognosis. Okay. And as a patient, if you don't get those 3 things, if you don't get what's wrong with you, what am I going to do about it, and how long is it going to take for it to get better, then that's an indication, a red flag right away, that you're not going to be fulfilled with the therapy that you're getting. Okay. And lastly, on that first visit, we need to do something. We can't just sit there and talk your ear off like I'm doing right now. You have to do something and get something done to you to understand the full benefit, because I want to know if there's a change, and that change can happen in an hour. So you have to make sure you're getting those 3 things, and if you're not, it's time to dump your therapist. Okay, and those 3 things translate to every visit. They need to check in with you. How you doing? What is still wrong with you, because that wrong can change over a course of 2 or 3 days. That's how quickly change should happen in some cases. So you need to know, reevaluate them. If you're not getting reevaluated as a patient daily, red flag, okay? If they're not changing exercises with you based on where you are in your healing phase, you need to reevaluate, because that's another red flag. And thirdly, if they're passing you off, that's a red flag, y'all. Get out of there. Get out of that situation, because you need a therapist who's going to know you, know what works for you, and not pass you along to a PT assistant or a tech or another therapist, and one that interacts with you. So please, please, please take those things into consideration. If you need help, shoot me a line. Um, I don't want you to ghost anybody. I don't want to be ghosted. I don't want to, drop patients, and I want to be able to help people. So, again, I have strategies for therapists. Look for the blog on that. I'll put that out there in the next couple days. So, thanks for listening, guys. Take care. Don't get ghosted.